So in your talk, you also alluded to data that is collected with minimal user intervention. So things, for instance, such as accelerometer data, or things that come from wearable devices. And my concern is that some of these measurements might be inaccurate if the sensors are not properly calibrated. So I wanted to ask, how do you deal with such inaccuracy when doing monitoring?
Yeah, I totally agree. So there is this big term of big data, and big data seems to be, even if data are not precise, you can use them because you have a lot of data. I don't agree with this. So I think we have a significant problem if we are collecting data in the wrong way, and if, for example, things are not calibrated. Then I think we will have a problem. So, for example, mobility tracking. Yeah? I think mobility tracking is quite nice, and of course we cannot be all the time with the patient to check his mobility. What we are, for example, doing, we are doing a test in our center where we can measure the mobility with other tools. In parallel, we are using the mobile device, and then we can link the mobile device with our test result, and then we understand what happens if patient is in the country, in his house, in his daily life. What happens to this? I think that is a big issue. So it's not a matter to collect data, but to collect data in a precise way, and that, I think, makes a difference between some strange apps and really a medical device. So we have to do a lot of development steps really to increase the quality, because if we collect things at a low quality level, I think we cannot rely on it. And I think that is crucial, and all patients, I think, collecting data, I think they should know that it does only make sense if the data are collected in a precise way.
That's great. So to follow on that question, I was wondering, so a lot of this data that's being collected, let's say for instance by wearable devices, has a sort of an abstracted sort of representation. So how do you make that kind of accessible to human experts in a easy to grasp manner to actually influence monitoring?
Yeah, I think at the moment it's very complex, because the signature which is inside this signal, I think there's a lot of information inside which is not used at current times. For example, of course, it can measure altitude. You can measure, for example, how many levels you go up a day, like looking, for example, at your iPhone. But I think the problem is that more information is not available. It would be, for example, very interesting whether you change your speed while walking up. And there, I think we have to learn a lot. We have to develop algorithms which transfer the very complex accelerometer data set into a way which can be understood by the physician and by the patient. And I think the patient is, in this respect, very close to the patient, because he does not understand this very complex digital data. And what we have now to define, like, for example, raw data of an MRI, it has to be translated in an image which can be seen by the physician and by the patient. And the same is true for the digital raw data. We have to convert them in a format that could be read in clinical practice. Because if you collect the data and if you say, oh, that's a lot of 500 megabyte, a lot of data, but you cannot use this data, I think then this approach is probably interesting for research. But at the end, our overall aim is to get it into clinical practice, and I think that will be the big issue. Yeah.
Okay, and maybe one final question, because you've been talking a lot about big data, and you also mentioned briefly in your talk privacy aspects. So how do you keep the right trade-off between getting the most out of the value in the data while preserving, to some extent, user privacy?
I think we have a very interesting tendency. On the one side, I think in medicine we have to be more and more careful regarding data privacy. On the other side, a lot of private persons give a lot of data, make a lot of data available without any restrictions. So I'm certainly a little bit concerned about the behavior of some persons about the availability of data. And these are tendencies which directly go in the totally different direction. But on the other side, if we would like to integrate this type of data into medicine, I think we have to fulfill full data privacy, and this data I think have to be used in this way, and we have to fulfill, especially it depends from country to country. For example, Germany has a very strict data security law, and they are especially linking private data with the hospital systems. I think there we have to be crucial. And what we learned and what is our approach, for example, we created our own portal, and this portal is behind a big firewall, and the patient can log in, and then the data are transferred in the system. But it's usually quite difficult if you have, for example, companies like Google who have more an open data privacy thinking, and I think there we have to solution, because I think it would be the end of digital data if privacy would not be exactly. Is this data could be, for example, used and sent to insurances or to your employer and so on. I think that's why our need is to find a way to integrate data on the one side, but on the other side to fulfill the data security which is necessary.
All right, thanks very much.
Yeah.